talk on the occasion of the World Heart Day. The World Heart Day is on the 29th of September, which is today. And we are going through a transition, a phase. And the phase is because of this virus which has struck us, which is called COVID. So the SARS COVID-2 virus or the COVID-19 has created a real pandemic the world over. At the same time, India is grossly affected, and so is our city of Mumbai and Mumbaikars. Now, there would be a lot of questions which engage people out there, and I think today's session is basically not us talking, not the doctors talking, but the people asking questions, and we would be happy to answer the questions. I have a very eminent panel today with us. My medical director is there, Dr. Manish Gupta, and Dr. Rushikesh Patil is the interventional cardiologist. Dr. Irfan Khan would be joining us shortly. Dr. Vimal Palhuja is the metabolic physician in this hospital and the diabetologist. And there are lots of issues with COVID and the blood sugar levels. Now, this is something that Dr. Vimal will address. Dr. Swaroop Pal is a cardiovascular thoracic surgeon, but I'm sorry, Dr. Swaroop may not be able to attend this session today as he is already in the operation theater with an emergency. Dr. Grishma is responsible for cardiac rehabilitation. Now, most people, when they get well and they go home, they feel that cardiac rehabilitation is put on your walking shoes and go for a walk, which may be graded. But that's not so. There is a method by which people are brought back into the mainstream, and that is what Dr. Grishma does, along with Dr. Swanand Kulkarni, who also coaches people back to normal activities of life post a myocardial event. Very importantly, if you really want to understand fitness and stability as far as all your blood parameters and everything goes, is all starts at the kitchen. And if your dietitian does not advise you on your diet, then no matter how much you exercise, if you eat all the wrong kinds of things, you're not going to improve. So Dr. Richa will be there with us talking about the diet. So if we're joined by a panel of people, then we could take your questions, and please do call out the person concerned, and they could take the questions, or I would request Dr. Manish, if there are certain questions that you have, you may just shoot the questions out, and the people who are joining us live will then take the questions, or they will ask us the questions and we will give the answers. So today I would very briefly like all the panelists to give some opening sentences about myocardial disorders and life in general, or how do we help our heart to help our lives. So let me start with the cardiologist, Dr. Rushikesh, and then we will, I would call out your names, and if you would please just say a couple of sentences, keeping it brief, more time for the question and answers. So Dr. Rushikesh, off you go.
Yeah, good evening, everyone. I think in this unprecedented time of COVID, where everyone is afraid about COVID affecting heart and all, we need to be extra careful. So how exactly we need to be careful? So our theme will be use heartbeats to control our beats. So common fear for the peoples are whether I am having a heart disease, whether I will be more exposed to get a COVID disease or no. So that dilemma I will cover one by one. So you should know that you should take extra care, use your beats to control your beats.
So, Dr. Vimal, would you like to jump in to corroborate that as far as COVID, diabetes, heart is concerned? Dr. Vimal, you're muted. Dr. Vimal, you're muted.
Am I audible now?
Yes.
Yeah. Good evening, everybody. And as Dr. Rishikesh said, that this is unprecedented times of COVID-19, and the World Heart Day is being celebrated with the theme that control your heart disease by with the heart. So we have to use our heart. How can we use our heart? By putting all our soul inside and trying to take care of the heart disease. How do we do it? By right diet, by exercise, laying off the fear of coronavirus, because the fear is killing more than the virus itself. So the heart disease is there, is going to be affected not because of the virus, but because of the underlying conditions like diabetes, like obesity. We have to take care of that first. Virus is there, will come and go, but we are not supposed to forget that these diseases will be there for years together with us. Hence, these have to be taken with all precautions have to be taken for controlling these factors. Otherwise, we will not win the battle. The collateral damage which coronavirus is doing, we will not win that war against the coronavirus. That's what my take on this thing is.
May I ask Dr. Irfan just to come in with a few words?
Hello, can you all hear me?
Yes, yes.
Yeah, yes. Good evening, all of you. Yeah. So basically, the theme for today's World Heart Day event is use heart to beat heart. Basically, what we have to see is that we don't lose the initiative which we have got. See, all the patients who are suffering from heart disease, whether it is subsequent to hypertension, diabetes, mellitus, ischemic heart disease, and all, and whatever gains they have achieved in the last few years or so by their dietary changes, by their lifestyle changes, by properly following on medication, should not be lost because of this coronavirus pandemic. What we have seen in the last 6 months is that patients who are basically confined to their houses, okay, and they have really whatever lifestyle changes which they had adopted, probably they had gone for a toss. Okay, and we are seeing now, probably it's now around 6 months or so. Now those patients who were not following up with us in the initial stages because of the fear of the virus, now they are coming back to us with some or the other complication, maybe like uncontrolled diabetes, uncontrolled sugar, uncontrolled blood pressure, patients who have just stopped their medications on their own for whatever reason, weight gain because the gyms have stopped, the cardiac rehabilitation which was there is not functioning since last 6 months. So I want to tell all my patients who are there listening to me that please don't lose that initiative which we have got. Okay, we can perform angioplasties, we can perform treatment, we can put stents, we can do bypasses and all, but the maximum treatment part, I always tell to my patient, is going to happen at home. Okay, so whatever we are going to give you here is only a 5-day kind of a treatment. We can give you a boost, but whatever treatment which is going to happen to you, which is going to remain for you for a lifetime, is your lifestyle changes. So please don't lose that because of this coronavirus pandemic. We might get a vaccine, we might not get a vaccine. When the vaccine is going to come, we don't know. But yes, we have to follow certain hygienic measures, certain sanitization measures, and we have to probably live with it at least for the next 6 months or so. But yes, we have to also see to it that the other diseases which are there in our community, they should not get flared up because of this coronavirus pandemic. So as a result, probably, I think what Dr. Pahuja also told about this collateral damage which is happening. Okay, so it's not that the lives which were saved because of this lockdown or people not visiting each other, maintaining social distance, and on the other end, we are seeing a lot of patients who are coming with sudden cardiac death to the casualty. So probably the theme for today is use heart to beat heart. I think you should also use your mind also, that this pandemic is probably going to stay there for a long period of time, and we have to kind of adapt ourselves to these changes which have happened in our environment, community, and all.
Thank you, Dr. Irfan. And if I could go to Dr. Grishma, we are not very active as far as the rehabilitation is concerned, but what would be your take at this particular point in time? How do people slowly come back to the hospital and understand that it's absolutely a safe environment and you can go back to your cardiac rehabilitation.
Thank you, Dr. Chatterjee. Good evening, everyone. On the eve of World Heart Day today, as you all know, Doctors Irfan Khan, Dr. Rishikesh Patil, and Dr. Vimal Pahuja, they have already said that the theme for today is use your heart to beat heart disease, and which means that at the end of this particular seminar, I hope all of you make a strong resolution to make better heart healthy choices for yourself and for your loved ones. Having said that, coming to physical activity, yes, sir, the lockdown has definitely impacted, say, gymnasiums or cardiac rehabilitation center that we have. And having said that, physical activity need not come to a stop. If you are not exercising previously, this is a good time to start exercising. Indoors versus outdoors, you have both the option to exercise. For a cardiac patient or somebody with, say, a medical condition, it is safer to exercise in a cardiac rehabilitation center where there are safety personnel around, people who can take emergency actions if required, and where all the strict sanitary precautions are being taken, along with the other norms such as social distancing and use of mask and hand hygiene. So, coming to the point of safety of the exercise, I think we as a center are functioning as have started our function over the past 2 months, and patients are coming in. We have patients who have enrolled for cardiac rehab, and they are exercising very safely with us.
Great. Nice to know that. And Dr. Swanand, what is it that you would feel? Dr. Swanand, can you hear me? Yeah. You, Dr. Swanand, I think you're on mute. We can't hear you. Dr. Swanand, you're on mute, I think. No, I'm sorry, we can't hear you.
Yes, can you hear me now?
Yeah, yeah, now you're through.
Can you hear me now?
Yeah, yeah.
Okay, great. So every coin has two sides, and definitely we have to see a positive side, of course. So during this lockdown, definitely the positive side, what we should see is basically we are blessed, we are being gifted with a lot of time. Our travel has reduced, our working hours have reduced, so probably it is like at the 1 point precisely. So definitely we can use this time at home to do better exercises, to have a better lifestyle, to have a better health, to have a better healthy diet. And definitely we can expect a better lifestyle at the end of the COVID. And definitely, as to start with, definitely we have to start with your exercises, and definitely that lifestyle change will happen on a gradual basis. Rome was not built overnight, neither your health is. So health and the immunity goes together, and to improve the immunity, to have a better lifestyle, to have a better exercise tolerance to each and every individual, we have to start exercising. And exercise can be done anywhere, everywhere, at any given point of time. It's just what we want is a will. And definitely, as we have time, we have the will. Definitely, life and all the health is in our hands.
Great. Thank you very much. So, Richa, I think that fitness of any sort begins at the kitchen. So, at this particular time, since we're talking about the heart, very, very, very briefly, would you give us your thoughts on fitness and the kitchen?
Good evening, everyone. Very, very well said by Dr. Swanand that let's take this as a blessing. And at least for all my cardiac patients, everyone who's been on a heart healthy diet, trust me, you're following a very, very bad, which is best protection, not keeping your heart, but also kind of boosting your immunity at all given times to fight or any other viruses. Teaching healthy and keep exercising, and that's what works for you. And like a heart healthy heart diet needs to be holistic, so does the virus is what everyone wants to know about. So your heart will continue to protect you if you've been protecting it with the right diet. So the whole idea, I will answer your questions, of course, but is to have a balanced diet. At the end of it, there is not just one food that we need to look at, but a complete balanced meal that we keep harping about all the time to our patients is what you need to continue eating holistically, getting all your food groups, your dal, roti, rice, vegetables, fruits, and not just one miracle food that you need to look at, but the whole approach has to be wholesome in nature. And don't bank on any one foods. Don't bank on any one miracle food. And I think you will be able to survive this pandemic healthier and you'll come out stronger.
Great. So I come back now to Dr. Manish Gupta. If you can just give us a wind-up summary before we go to the questions. There are a large number of questions which have come by the panelists, so we must address that quickly. So Dr. Manish, if you can just give us a quick roundup, and then we will move on to the questions.
So, good evening, everybody, and it's a pleasure to have everybody on the board here and my senior consultant colleagues. In short, today is the World Heart Day, and we have to keep our heart pumping. And whatever comes in the way because of the corona, the treatment modalities have not stopped. Our hospital is standby 24/7. We have casualty facilities. We have emergency running. We have all protocols made in such a way that patients can approach to us anytime during the day. And our cardiac team, our cardiac rehabilitation centers, all are working. We have stringent protocols wherein there is no fear of getting contacted with anybody. We have protocols in such a way that the social distancing measures and the sanitizing methods are being all followed, and things can be carried out. So I don't think there will be any doubt from anybody in terms of the modalities of the hospital services which you are providing. We have a special task force, the infection task force, which works on these subjects. So all facilities are stringently made on strict protocols, and the protocols are followed first. So if anybody have questions, because this is a very
See, the questions, let's start taking the questions. Now, the first question that I see is, please let us know the emergency medicines to keep home or while traveling for a heart attack. This is a question which has been, and I would like any of the cardiologists to take this, if we can do that, either
Right.
Irfan or Rushikesh, or
Yeah.
both, preferably.
Yeah, I think I will just like to say something before we go for the emergency thing. So one thing people are always afraid, if I'm in a heart disease, whether I will get the COVID more commonly or no. So let me first take out that one. So if you have a heart disease, you are equally high risk to get a COVID disease compared to with the common people. Only difference that the symptomatic nature of COVID in heart patients will be more common. Like 90% of patients who are otherwise no heart issues will be mildly symptomatic or asymptomatic, while those who have a heart issue, they will be having more common symptoms. Okay. Now, when they have a COVID disease, they are more likely to have a presentations. And COVID, if you'll ask me, almost 7 to 22% of these patients have associated heart problem. People are afraid to come to the hospital if they have a fever and cough, thinking they may get isolated, they get quarantined, or first there are signs of denial. So many times people try to come late in the hospital, and these are the time where they land in trouble. Because once the disease goes to advanced stage, there are certain stages where we can give medicines and it gets delayed, and then we have very left with the minimal options, and the body response also become less. I'm telling you this because your first question is what we should do in emergency. So my first answer will be try avoid emergency as much as possible. If you notice that your symptoms of fever, cough, or there is an early suspicion of COVID, I will suggest seeking an early medical help is very utmost. Yeah, but let me tell you, the COVID can manifest as a direct heart attack in some patients who may not have the previous symptoms of it.
Dr. Rushikesh, sorry to interrupt, but the question really is, let us know what emergency medicines to keep at home or
Right.
while traveling for a heart attack. That's what they wanted to know. What
Right.
emergency
So
medicines I should have at home.
Right. So first, as I said, try avoid emergency if you are having chest pain, because many times they do have chest pain for 2-3 days and then they come once they have a major attack. So that's one, that to seek early medical help. Second thing, as I said, they may present with an acute heart attack. So these are the time, as a routine thing in all heart attack patients, we tell them to pop up 1 300 milligram of aspirin tablet. Okay, so these tablets, they need to be chewed rather than taking with the water. Okay, so that when they chew, they get rapidly absorbed through our buccal mucosa and action is faster. So that have shown the mortality benefit. Almost 30 to 50% of patients can be saved by simply taking 1 300 milligram of aspirin. Over and above, you can take sorbited tablet if you think this pain is because of heart attack. There can have a problem with sorbitrate, that patient's BP may fall down, patient may have giddiness and they may become unconscious. So you have to just ensure that if you're taking such sorbitrate tablets, either you take it in seating or lying down position. Sorbitrate tablet, it is available as 10 milligram tablet. You can take 5 milligram, that is a half tablet sublingual on SOS basis. So medicine, what you can keep it an emergency in heart attack patients, I will suggest keep a 300 milligram or aspirin 300 strips. Commonly in the market, you will get 75, 150, I will say Disprin 300, or you can take 2 tablets of aspirin. Sorbitrate tablet, you can keep it, but it is mainly for the symptom benefit. And most important, you come to the hospital rather than thinking that it is simply acidity, and this is not the right time to go to the hospital. So I'll say not to neglect your symptoms and please come to the hospital where adequate facilities of isolations and other things will be taken care of. I hand over to you, sir.
Right. Dr. Irfan, I would just like to put a point. There's a question which says stress inducing heart attacks, myth or reality? And here, after Dr. Irfan, if our physical consultants like Grishma and Swanand can also address this. So over to you, Dr. Irfan. What we are
Stress
talking
in
about is stress, myth or reality, if it causes a heart attack. Stress,
Yeah, no.
stress giving rise to heart attack.
Definitely, it's stress-inducing heart attacks. I think if you see the incidence of heart attacks, probably which were 20 years back when I joined my medical course, and now on, definitely it has increased. Okay, we all know that the age range of the population, which was maybe in the 60s or so, maybe we were seeing in the sixth or seventh decade of life, when MI happening in a young patient was very rare. Now we are seeing patients maybe every month or so, 2 or 3 patients who are coming to us, especially pre-COVID. We had 2 or 3 patients coming to us who were young patients who are having heart attack. In this COVID scenario, also we are seeing patients who are suffering from COVID or who don't have symptoms of COVID and they just present with heart attack. So what is the reason for this? Definitely stress is one of the most important factors which is playing a part in young patients having heart attack. Now, probably our lifestyle, which was there 20 years back, which was literally not so much technology driven, okay, where human to human connect was more. Now that human to human connect has lost, and definitely the day to day stresses, whether personal, social, economical, and the have significantly risen. Okay, and that is why we are seeing a rise in markers of stresses like apolipoprotein A, homocysteine, markers of inflammation, and we are seeing that these patients who are under stress, they have a problem in their they are smokers, they consume alcohol, they beyond a prescribed limit, and they have deranged lipid profiles and all. They don't follow a healthy diet and lifestyle. Some people have also told that maybe I could not quote them, that having a stress which is persistent for a significant amount of time is the equivalent to smoking cigarettes also. So definitely it is not a myth, it is a reality that stress causes heart diseases, heart attacks. If you are predisposed, then stress will also lead to early progression of atherosclerosis and all. So definitely it's not a myth, it's quite a reality of the present generation and present century.
Yeah, I would like Dr. Grishma and Dr. Swanand to come in to say how we can modulate the stress through activities. And then, Dr. Richa, if you could take up the diet issue.
Sure. Dr. Grishma?
Yes, sir. Am I audible?
Yes, yes, you are audible.
Okay, great. Yes.
Yeah, Vinay.
So,
Yeah.
or
Hello.
the exercise, whenever you perform a moderate exercise, there are certain hormones, there are certain chemicals that are released in the brain. Okay, these are called what we say happy chemicals, and these are the ones that relax you. Those are the ones that reduce your stress. These are the chemicals that what we typically call a runner's kick for someone. That is, these are the chemicals that keeps you motivated to do the same routine of moderate to high intensity exercise over and over again. And as to add to the question, and to reiterate Dr. Irfan's statement, I would also say yes, stress is indeed one of the uh, major causes of heart attacks in the current lifestyle that we have seen. And it is also affecting, a stressful lifestyle is also affecting women in the reproductive age group who are supposed to be cardioprotected by estrogen, but because of stress, they are also landing up with heart related issues. And Dr. Swanan, would you like to add something?
Uh, I would like to add one thing is basically, of course, the stress is directly associated with the cortisols. So that is obviously the stress hormone. And definitely reducing metabolism, definitely be having the secondary complications like diabetes or the hypertension. And eventually, as the diabetes and hypertension is leading into the cardiac diseases like single vessel disease, multi vessel disease, and then landing up into the emergencies. So, of course, it's not a myth, it's a reality, of course, precisely because of the stress levels. Whatever it could be social, it could be economical, it could be peer pressures, it could be anything, you name it. The stress is there in the complete age group of, like, say, from the adolescents to the elderly. It is not specified to one specific group, but it's for everyone. And yes, we are seeing the patients as metabolically challenged as the early as like 16 and 17 with a very high obesity.
Yeah.
We are having the patients with undergoing the angioplasty at the age of 22. And of
Yeah.
course, as the age progresses, again, the secondary complications are again there, precisely as the age-related complications going to be there. So, of course, this stress is the reality. It's not a myth, of course. And to modify that, definitely exercises does help. But only exercise definitely does not help. It requires the prescription of the exercise so that you should be evaluated properly. You should be given the channelization of your exercise properly, and the consistency of an individual to do the exercises is at most important to maintain and definitely then progress in an individual's life forever. So that's it. Um, sir, you're on mute, sir.
Think stressors. Richa, you're muted.
So, as far as the diet is concerned, during this time, just a lot on the kinds of oil. I've always maintained that the quantity of oil is more important than the actual quality of oil, because there is a lot of cooking which is going on, and people are cooking on their own. The of oil have gone up in a lot of households. So you have to look at using lesser amount of saturated fats. You have to look at down your butter and ghee further down, because you need to understand that the diet plan was keeping in mind a lot more physical activity. People have now resumed walks to a certain extent. They are stepping out, they're moving around. But there's no going to office, there's no commuting. So since the physical activity has come down, total calorie intake needs to come down. But unfortunately, because people are at home and there's nothing to do, people tend to be eating a little more. So the emphasis has to be on staying full with foods that are not very calorie dense. So there has to be, more focus on maybe making different kinds of fruit tarts and fruit smoothies rather than on dalgona coffee or things which have a lot of whipped cream and a lot of cakes that are coming up. So, for instance, even if you're baking a cake, while I'm focusing more on reducing your saturated fats, try and include more of, sunflower or olive oil, or for that matter, even your almond oil. Incorporate these other oils. Try and reduce your total oil intake by at least 10 to 15%. So, where putting it simply, if we were giving you earlier, say about 4 teaspoons of oil, you need to now bring it down to about 3 or 2 to 3 teaspoons of oil. That becomes a mandate. In between snacking has to be fruits, it can be salads, it can be chas, it can be watermelon, it can be a simple glass of coconut water. This is a good time to have those seeds. Most people said that they forgot to eat seeds in between, those assorted seeds where it can be chia seeds and sesame seeds
Richa,
and
sorry to interrupt. Sorry to interrupt, but could you also elaborate a little bit on immunity boosting diet at this particular point in time? So the immunity also people are concerned about.
so immunity is a holistic. This is what I'm trying to tell you. It has to be your entire. You remember a five things. Just remember you need five things to boost your immunity. Your cereals, which is your roti or your rice or your oats or your jawar, bajra, ragi, any cereal. Your proteins from either dal or soya or paneer. Lean meats like fish or chicken. Cardiac patients can't obviously do red meat. The veggies, whole lot of vegetables, whatever you can get your hands on. Seasonal vegetables being the best, be it palak, methi, dudhi, parval, cabbage, cauliflower, your oil, your fruits, and your dry fruits. Water. These are your five immuno boosters. Do not rely only on haldiwala doodh or certain kadas, or just up your vitamin C intake through citrus fruits. It has to be. If you want a good immunity, it cannot be just taking alone vitamin or one food which is going to help you. A complete balanced diet is what is going to provide you the immunity which you need to stay healthy, to protect your heart, to protect you from corona, or to protect you from any virus. And for that, don't rely on anyone. So even if I'm talking about oils or certain seeds being good, alone won't work for you. You have to have balance of your fruits and everything. So these WhatsApp messages, these fad diets that you keep reading about, one or two things helping you with immunity, that doesn't work. It has to be your complete balanced meal. Your ghar ka
So
khana.
the bottom line really, Richa, is that it should be a balanced diet, and that what boosts immunity, which is the right point to make. But there is also a question, Dr. Vimal, and that is basically that during the COVID time, are there any alterations in blood sugar as well as cholesterol?
So, sir, because of the COVID times, what we've seen
That's
is
a question addressed to Dr. Vimal, Richa. Dr. Vimal, can you hear me?
Yes, sir,
Yeah,
I can hear you.
this question is
So,
directed at you as far as the cholesterol, as when
diabetes is concerned.
the sugars are concerned in the blood.
Yes, I mean, we are seeing a lot of patients who are coming with very high blood sugars when they have COVID, or they are not suffered from COVID also because of the lifestyle which has changed after the coronavirus. Mind you, the COVID virus is a kind of a multi-organ metabolic dysfunction. So virus is causing the metabolic disease, and that has been proven in the research. So what we will see, we see a lot of diabetes, which was not there before COVID. So sugars are going to go haywire. People who were at the brink of getting diabetes will get full-fledged diabetes or very high blood sugars. People who are not diabetic, also because of the change in economy, because of the social structure, because of the lifestyle, also are seeing higher blood sugars. People who are suffering from COVID also because of the viral dysfunction also showing higher blood sugars. So all this is all we are seeing. Another thing about the cholesterol, as I said, multi-organ metabolic disease is going to affect the cholesterol. It's going to affect the thyroid. It's going to affect the heart. It's going to affect your blood pressure. It is going to affect the kidneys and so on. So this is going to be seen in now. as well as later on in next 2 years, because there's a fingerprinting of the virus on your organs. If you have been affected, we don't know how many people are going to get affected with all the metabolic disease, which we'll be seeing last 2 years. We don't have much data, but it is expected that everything which I narrated before is going to increase by at least 5 to 10 fold in the near future. If we keep living our lives as we were living pre-COVID era, we have to change our lifestyles after this virus has actually affected the mankind. So this is the bottom line. Cholesterol, diabetes is going to worsen. Sugars are going to get haywire. We need to take care of those. And experts have already told what has to be used for exercise and diet. They have given you the clues how to go about this. So definitely we are going to see a surge in diabetes and cholesterol problems.
Right. Thank you, Vimal. Not really very happy news, but there's a question which is directed at the cardiologists on youngsters succumbing to cardiac arrests. So, what could be the reason, and what should people do in this age bracket? We're talking in terms of in the 40s, in the swinging 40s.
Yeah, so basically now I think I'll take this question. See, basically what we had was that I told in my earlier discussion also, we in the western areas people suffer from heart disease while they are in 60s, and while in Indians we suffer heart disease while we are in their 40s. What is the reason for that? Because we have early onset of hypertension, we have early onset of diabetes. Okay, we don't have that kind of a diet which we had 20 years back, and our genetic structure is also not adapted to that. We South Asians especially are not adopted to a Western kind of a diet. So probably a Westerner eating the same kind of a diet and we eating the same kind of a diet, or a kind of a fast moving uh, foods like burgers, pizzas, or now we have the Zomato and all, which are delivering to our doorstep. So we don't even have to step out or spend that calorie to even go to the restaurant and eat the food. So whatever it is leading to that is that the youngsters, basically who are in the 20s and all, they have accelerated atherosclerosis at this age. This atherosclerosis, compounded with hypertension and diabetes mellitus, uh, leads to progression of coronary artery disease, and you have heart attacks and all in the age group while they reach 45, around the age group. So what has to be done is that first we have to educate them that our genetic structure is not adopted to this kind of a diet. We have to tell them in schools, in colleges, that what kind of a diet we should adopt, what kind of a lifestyle we should adopt. We should have some very strict control regarding smoking. I think recently Maharashtra government also adopted that the sale of loose cigarettes is also banned. Okay, some kind of a statutory government control over these kind of abusive items, so that a kind of a lifestyle change is adopted by these youngsters. So probably by the time they are 45, because in the age group of 15 to 20, it's an age group in which they seem that death is very far from them. Okay, so they have a complete life to live, they don't have any experience of death, and once they are in the 35, 40, 45 age group, and they have responsibilities over their head, and probably then they realize, but that at that point of time it is too late. So probably inculcating healthy lifestyle while they are in their second or third decade of life will probably go a long way in preventing those kind of diseases which we see in the age group of 40 to 50. Uh, there are a few questions also raised about some deaths which are happening in gymnasiums. People who are exercising, still they are having deaths. Probably the reason for those kind of death is that there is a medical term called as ventricular tachycardia, which happens in these kind of patients. Probably they have sudden spurt of very high heart rate, and the only treatment what they require at that point of a time is a defibrillating shock, and that is why if they don't receive that in the next 10 minutes or so, they are going to collapse. There is going to be a cardiovascular collapse or death. Especially what we have to do is that we have to search for such patients, people who are doing extreme high intensity kind of exercises or high intensity training, and if they have a family history of cardiovascular death, or they have history of dyslipidemia, hypertension, or diabetes mellitus, they should at least get themselves checked with a stress test or a cardiological evaluation before going on for this kind of high intensity training. Supplements also, people they are taking steroid supplements also, so probably that could also play a role in them having heart diseases. So definitely we have to look into it's a multifactorial kind of a treatment, but yes, education, information, appropriate consultation, and treatment would definitely go a long way in reducing this kind of a cardiovascular disease burden, especially in that 45-year age group.
Right. Thank you, Irfan. A corollary to this question, Rishikesh, is that is the risk of heart disease increased during COVID times or with COVID patients? For example, COVID patients and heart disease. Does the risk increase just because you've got COVID? That's something that is a question which has been put up by the panelists. Not the panelists, but the viewers. Sorry.
Right. So COVID and heart disease, as I said first, the incidence of getting the COVID in heart patients are more or less same. It is just that they are more symptomatic if they get a COVID in a heart patients. More symptomatic means they have a more serious presentations of COVID as well as worsening of condition. Now, why the worsening of this? The COVID also has a special affinity to the lung as well as for the heart. So the heart involvement in COVID is a varied. So as I tell common people that when we say the heart is like a hall, so there are some electric connection, there are some plumbing connection, and there's structure. So the COVID affects almost every part. So it do affect the electric system of the heart. So many times these patients, they have a palpitations, they have a irregular beat, especially those with the elderly patients. They're presenting with a palpitation. It do affect the plumbing system of heart. Like these are the patients, the COVID affecting the stress during COVID or the COVID itself causing inflammation to the vessel wall, leading to the more episodes of heart attack or a minor episodes of chest pain or anginal pain, or it is causing a blood to form a coagulation and that is giving heart attack. And third thing, the COVID itself affecting the heart function, which is leading to heart function to on lower side. So definitely COVID in a heart disease, it is affecting in all possible ways of palpitation, reduced heart function leading to breathlessness and new episodes of heart attack or chest pain.
Right, right. Dr. Manish, this question is basically about the hospital as to people want to know that though we want to come to the hospital, but we're a little, apprehensive of coming to the hospital. So I think from your point of view, if you can sort of clarify, why do you think that the hospital is reasonably safe place or a completely safe place to come to? Dr. Manish, you're muted. Dr. Manish, you're muted. Yeah. You're muted. Yeah.
Yeah. The hospital is very safe, and people should be confident enough that we have very stringent safety protocols. People don't need to fear because we have separate entries for COVID patients and non-COVID patients. The emergency department takes inside all those patients who are related with heart disease, and the protocol which is always there is to follow the cardiac emergency calls. They are followed separately, and there is no mixing of even the staff for COVID and non-COVID patients. So we take the patient inside our casualty area, which is segregated from the COVID area, and so there are also kind of safety precautions are taken. The people here in the staff or in PPE kit, and the rest of the thing which is assured is like our investigations. We take the patient to the cath lab, so there is a separate lift, dedicated lift, which is again with all sanitary precautions are taken. So it is not the same lift which is used by the COVID or the other patients. It is a separate lift which is sanitized. So that passage towards to the cath lab is all safe. It is total separate passage which is all sanitized, and that's how the patient movement is taken place. So the patients or the people in the community should not feel that unsafe situation because of the corona everywhere. They can come with the mask, which is an essential thing, and they can keep the social distancing. So overall, the whole picture is made in such a way, separate entry, separate movement, in such a way that there is no mixing anywhere. So whoever is approaching the hospital can be very much relaxed. If someone wants to attend our cardiac OPD, this is separate entry for the cardiac OPD. So someone doesn't need to go through the COVID area. Yes, if the patient is COVID, in that case, the patient has to go to the
Very well
fever
put.
clinic and get examined.
It's very well put.
What I want to do is, yeah, thank you, sir. Thank you. So what I wanted to convey, if there is a cardiac 2D echo required, the patient does not need to hesitate. He can just enter from the first door as he was doing it normal course, as if there is no corona. But he has to carry a mask. He can come up. He can meet the doctors, keep social distancing, and things will be worked as if it is a normal
Right.
circumstances. For corona patients, it is separate.
There
Yes,
is
sir.
also another question which actually Grishma and Swanand should be able to answer, is that seniors today, what kind of exercise can adults or senior citizens do at home to stay healthy or stay heart healthy? That is more the question. What exercises can you do at home? So between Grishma and Swanand, I think you all should tackle this. I think you're muted.
Yeah, can you hear me?
Yes.
Exercise for the senior citizens at home. So all
Yes.
activity on foot is what I will call an exercise. In fact, we have a separate senior citizen program that we have, and some of the senior citizens, we are guiding them with a home exercise plan. And basic activities that can be done, and the foremost activity is walking within the house, walking when you're watching TV, getting up from the sofa while you're watching TV. All this constitutes activities that senior citizens can do. In addition to this, there are separate balance exercises that they can do. However, those have to be done under medical supervision, or they can be done once they have been taught by a physical therapist or an exercise specialist. And these exercises also can be done within the home. Having said that, if you are exercising indoors, let me also clarify, you really need not wear a mask. Another exercise that you can do within your house is going up and down the stairs if you have been doing it before. All the activities that you have been doing it before can be safely done. One disclaimer I want to put forth is do not attempt any activity that you have not done before, especially during these times, or increase your intensity of the exercise if you haven't been doing the same exercise before.
I would like to add a little bit further to that, if I may. So basically, there are two perspectives right now. It's about one is who is COVID positive, who was COVID positive, and who is COVID negative, of course. Home quarantine, not quarantine. Individual is doing the exercises at home. Basically, it is absolutely fine. Whatever Grishma said, absolutely to the T, absolutely should be done. But to the further, specifically, I really would appreciate if that exercise been prescribed to an individual after the evaluation. The evaluation could be preferably, if it is physical, that is personal evaluation, which is much more better, so that we will be knowing exactly what are you up to physically, personally. If not possible, then definitely the other perspective is online consultation. Of course, that is having pros and cons, of course, but if there is no option available, then the second thing. Forms of exercise, again, anything will definitely be welcomed. Something is always better than nothing. Second thing, it goes up to 3 generations. Like majority of our generations are at home because of the lockdown. Nobody's moving out of the house precisely. So there are 3 generations. One is a child, one is the adult, one is the elderly gentleman. So all the 3 participants definitely have to do the exercises, have to be physically active precisely. And with the physical activity, definitely a few more things which adds up is basically your ergonomics. The ergonomics of an individual who is working from home, sitting in front of the laptop, the iPad, sitting for like 8 to 10 hours, 12 hours, 14 hours continuously. Definitely, we need to take certain breaks. We need to be having some different environment you should be doing the exercises in. taking every 45 minutes frequent breaks, go for a walk, maybe some stretches, definitely that helps. According to that, and as per that specifically, even the hydration, the drinking of your water, the water intake definitely makes a huge difference. Richa ma'am was also involved about it, spoke about it. It's about the immunity busters. Definitely we have to add a bit amount of hydration as well. Unless and until the cardiologist or your physician has asked you not to drink a certain amount of water, definitely you should be drinking prescribed amount of water as per the exercise specialist also has told you. And the last thing is specifically about the elderly generation, what they should be doing. Um Something is better than nothing, of course, but definitely more frequently if they can do physical activity, it will be more welcomed. First, second, with the low intensity, if they can do the exercise, which will definitely be avoiding any kind of an emergency secondary complications. Third, different types of exercise within the house. For an example, sit to stand from the chair, sit to stand from the bed, maybe from a different heights. Walking on the spot also can help. Definitely, even picking up a water bottle from the fridge and keeping it to the dining table, definitely is also another exercise. Using different weights in the house, maybe whatever the grocery you get it, half a kilo, 1 kilo, 750 grams, whatever it is, definitely repeating the same thing will also help you doing the exercise. And it's it's throughout the day, not a particular like, oh, I'm going to do only exercise morning and evening is not going to help. For the elderly generation, definitely you have to be active. Definitely that should be prescribed, and
So,
that should
Dr.
be
Swanand, what you're saying is that continuous exercise is better than a one-off, which is a very
yes,
valid point and very important point that you have brought out. And
yes.
Dr. Richa, there is a question for you, and that is, what is the best diet which ensures omega-3 fatty acids and vitamin B12? So, this is also a question which I think, Richa, in brief, if you could just sort of put things together. Richa, are you in mute now at the moment? Yeah, go ahead.
I'm sorry, sir, I didn't get back to the question. Could you repeat it?
The question is, which is the best diet which ensures omega-3 fatty acids and vitamin B12?
So omega-3 fatty acids are getting through fish oils and partly through dry fruits. So if you're a vegetarian, you can forget about it and you can either take supplements or you can have your walnuts, some amount of almonds, and an assorted of all the dry fruits, which will take care of your omega-3. As far as B12 is concerned, B12 is seen more in your regular grains. So your wheat and all your wheat-based grains. So whether it's suji or it is maida, I would not advise, but your regular wheat flour, savia to a certain extent, all will provide B12 in your diet. And so this is all to even if you're on supplementation. Most people who are taking B complex things, it's okay to skip the regular natural diet. No, those are only supplements. But your grains have to be there to provide your B12 and your B vitamins and your flax seeds, your omega 3s.
Right. Dr. Vimal, this is a question for you. Is what is the impact of lockdown on physical activity and what is the metabolic cascade that can be expected? So, therefore,
Okay.
what is it that we are talking in terms of lockdown? Then there is hardly any physical activity. So, how is it going to overall affect our health from, the entire diabetic, hypertensive, whatever it is that our health gets affected? So that's a question for you, Dr. Vimal, which has been posted.
Thank you, sir. First of all, we are looking at one aspect, that is a physical activity in the lockdown. But there are many more such aspects which we need to understand. And the most important is the circadian rhythm. People have to understand the biological clock of the body is also disturbed because you are indoors. How it is disturbed? Because your exposure to sunlight is also reduced. So your brain doesn't understand whether it's night or day. So this is called change of biological clock and or circadian rhythm. Most diseases under the planet, under this sun, is because of change of this biological clock or circadian rhythm. Lack of sleep because you're sleeping in the day, or maybe you're doing a lot of gadgets during the day, or also in the night, probably changes the biological clock. Sleep is disturbed, physical activity goes down. Everything contributes to what is called as metabolic derangements. How? By changing the biological clock, you are causing the organ dysfunction, because if the brain is sleeping, one organ is awake. Organs should be in sync. If the brain is sleeping, everybody organs should sleep. If brain is awake, all organs should be awake. This is what actually the biological clock means. But this is not happening now. When the brain is awake, other organs are sleeping, all other organs are awake, our brain is sleeping. Because of this mismatch, there's a change in the functioning of each organ. Stress is building up because of that, and there is a lot of inflammation being created. Inflammation leads to more hypertension, more worsening of atherosclerosis, with lack of physical activity, more caloric accumulation, more fat accumulation in the belly, causing more of metabolic syndrome, which is means high triglycerides in your system, increased blood pressure, high blood sugars, and high risk of heart disease
And
during the
female
lockdown.
ventricle sometimes.
So these things are affecting the system entirely, not only the physical activity, but
Male
your
patient,
sleep
fish
cycle,
for you booked.
circadian rhythm change your biological clock, and feeding cycle also is changed.
Then I'll
Dr. Richa
forward
was
that to
mentioning
her.
about Dr. Richa was mentioning about feeding, that people are trying execute kind of cuisines at home. But if you look at the feeding cycle also, which was somewhere around maybe 8 to 10 hours earlier, now it's become more because people are sitting at home and eating. So feeding cycle has also increased. That has put a pressure on your metabolic system, and this will lead to all the issues in the future. You will see all the sugars. If you have worked on your sugars, and Irfan also, Dr. Irfan mentioned that whatever we have पहले जो कमाया था वो पूरा खो दिया, because you have destroyed the blood sugar which you have controlled. Cholesterol has gone for a toss, and your blood pressure also going up. So this is what is going to happen, and we have to be careful about these things which I just spoke. Thank you, sir.
Very nicely put, Dr. Vimal. It's extremely good. Today, we are finding a lot of people who are talking in terms of pulse oximeter being helpful in gauging heart health. Now, how can one anticipate, or are there any signs of a chest issue? So I think the basic question is that will a pulse oximeter really help in, I think it's related to COVID. So will a pulse oximeter really help? The other, I think one of the cardiologists, either Dr. Irfan or Dr. Rishikesh, can handle this. But I want Dr. Manish also to say that, tell us about home health care. How can we give devices can help patient monitor themselves at home? So first part of the question is the help of the pulse oximeter in getting anticipating if there is a chest issue, and the second is that what can the hospital do to help people evaluate themselves at home?
Right. About the pulse oximeter, I would like to say, especially in a COVID time, we have a special entity we call as a hypoxia, where patient is not much symptomatic, but you will notice the saturation is going on the lower side. So pulse oximeter in this time definitely will help us to re-stratify certain patients who are at high risk or no. So those people whose baseline saturation are 95% and more, or those who are having already a heart issues and saturations are well maintaining and there are no symptoms, I will suggest we can just monitor such patients at home, or many times those patients who are following in our OPD, we do tell them to monitor the saturation and pulse at home. So one, yes, the saturation more than 95%, otherwise asymptomatic, will say just monitor. Those people whose saturation is below 95% and those obvious signs of fever are there, we definitely tell them to seek a medical help. Sometimes we do tell them to walk for 5 minutes and see there is a fall in saturation. So pulse ox helps us to diagnose such happy hypoxia entity. Then the patients who are at risk to get a further deoxygenation by measuring the saturation. And third, we can also see the pulse in such patients. So abnormally high pulse like 110 or 120 and more at rest in such patients could be an early alarming sign where we can pick up such patients. And I think Dr. Manish Gupta sir will tell about the home care management in such patients.
Yeah, thank you, Dr. Rishikesh. We have a home quarantine package, so patients can avail that package, wherein we give teleconsultation and the SpO2 monitoring device also. So This is very good. The whole package is contained in a step-by-step manner, wherein patient can talk to the consultant and get advices about his own physical health and all doubts regarding to corona. And he can get a prescription also online, which is uploaded by the consultant immediately. So the patient has an interface with the consultant where he can have his treatment, and he can, it is like an OPD, an online OPD. And at the same time, he can update the consultant about the his saturation levels and the heartbeats. So that is a very good robust system with us. In case the patient is required some blood investigation, so in such cases, the patient is advised about the investigation. The patient can come to us on our fever OPD, and he can get the investigation done. If suppose the patient is not a COVID patient, then he can walk into our normal pathology area, our OPD, where he can give the blood and other investigations. So the home care package is designed in such a way that for both the COVID and the non-COVID people, it is helpful, and especially for the COVID crucial home quarantine people, we have a continuous follow-up. So there is a day on a regular basis, there is a consultation from the treating physician. Hello, am I clear? Because I had some problem, voice.
No, I think you were very clearly and very concisely put it, Dr. Manish, and it is very, very clear to us and well as the audience. But now, Dr. Rushikesh and Dr. Irfan, this is a question that you see, there are some hospitals or some areas, people are always worried that if I have a heart attack, if should I go to a hospital or should I go to some place where I know that there are no COVID patients? So therefore, could you just both of you outline very briefly, because we are running out of time, about the management if we have a heart attack who comes in and we don't know the status of the patient? Then how do we move about it? If both of y'all can, highlight this.
Just I would, yeah. So I think even in this COVID scenario, I'd just like to briefly, before answering this question, I think there was an article in Mumbai Mirror in 15 days back that there was a COVID patient who was who had a heart attack and who had to wait for in the casualty somewhere in Chembur, who had to wait for around 7 to 8 hours getting a bed and getting himself operated. Okay, and he required some kind of an urgent intervention. And I would like to tell you that in the last 6 months, because of the hospital's administration and the general structure which it has established for COVID patient, non-COVID patient, heart attack patient, we are following the same protocol, irrespective whether the patient is COVID, non-COVID. We don't know the results. Now we are getting the results in an hour's time with the COVID antigen testing. But I think 3 months back, we never had the result before 24 hours. Despite that, patients who had come with an acute heart attack, patients who require an urgent intervention, by following strict measures, by wearing PPE kit, by maintaining asepsis, we successfully operated such patients. And in the last, till the time from March till this time, we had operated on physicians also who had cardiac events. So definitely, the hospital as well as the cardiac department in toto has done a great job in treating such patients. Now the question is whether if you have a heart attack or you have symptoms of a heart attack, whether you should go to a COVID hospital, whether you should go to a non-COVID hospital. I think you should first reach the hospital, whether it is COVID, whether it is non-COVID, immediately. Because what you need is that a diagnosis, you need somebody to look at you, somebody to tell you what is your situation, and somebody to take care of you. And probably you can put your health into the hands of the responsible person or the doctor who is there, so that he can further direct you from there to everywhere. So even if it is COVID, non-COVID, you should not search for hospitals. You should not do health shopping kind of a thing. You should immediately go to the hospital which is the most nearest. You should get an ECG done. You should get an evaluation by the doctor. Suppose there is an intervention required and it is not available at that hospital, then you can be transferred by a cardiac ambulance or anything else to a hospital which is the nearest to you. So I feel that probably the first thing is that which I always tell my patient is that you should you should tell immediately a friend or whoever is there, if you have symptoms of heart attack, that take me to the nearest hospital, because before I lose consciousness, before I am not able to take decisions on my own, I should be able to reach to a place where person responsible can take care of me. So I feel that our hospital has done a great job in this kind of a situation in the last 6 months or so, and probably people in and around Hiranandani who are listening to us, we are strictly following the same protocols pre-COVID also, which we are following pre-COVID, we are following COVID times also. So any kind of cardiac patient who has a myocardial infarction who require urgent intervention, he is not kept waiting here for beds, or he is not kept waiting here for intervention that the cardiologist will come. We immediately take patient for intervention despite the risk associated with it, so that the patient can be handled with utmost care and utmost respect. Over to you, sir.
Yeah.
Irfan, can I
Dr.
add to this?
Rishikesh,
Yeah.
yes, Dr. Rishikesh, your point of view.
Right. So I think I absolutely second Dr. Irfan. Only thing, see, I want to highlight the mortality of heart attack is almost 30%, while the mortality of COVID, if you'll ask me, is less than 5% in the present times. So it is your choice. Okay. Heart attack people dies more than COVID, in simple language, if I have to say. Second thing, heart attack, if you have, and if you get a timely treatment, this mortality from 30% can brought to less than 1%. So I just want to highlight the importance of coming to the hospital early rather than waiting and thinking if the COVID times are there, shall I go to hospital or no? So please seek early medical treatment to any nearby hospital, and then let the doctors from there to suggest you whether you really want to refer to a tertiary center or no. And obviously, if you're going directly to a tertiary center or our hospital, I will suggest we are taking utmost precautions, and the best in patient's interest, we are treating the patient.
Thank you, Dr.
Sir,
Rishikesh.
can I
Yes,
add something? That one
yes, of
sentence
course
here.
you must.
See, the virus doesn't know this is a COVID hospital or non-COVID hospital. Please, we are segregating into COVID or non-COVID hospital. Virus doesn't know. So whenever you go to a hospital which is so-called non-COVID hospital, your guard is down. People think there is non-COVID hospital. The precautions may be laxed. When you're going to any hospital where the precautions are taken, when every guard is appropriate, stringent protocols are being made, then of course you are more protected, because everything is done to protect you as well as the fellow patient as well as the doctor. So this is what is the times. There can be nothing like COVID hospital or non-COVID hospital. Everything has to function in this way only in the COVID times. So first thing is to save the heart. That is more important. Virus, getting infected virus is very less risky, and there's less chance of getting infected if you observe all your precautions and you're taking care of the standard precautions which have been told to you by the doctor. So there's nothing called a COVID or non-COVID hospital, as according.
I think that's philosophically extremely well put. I think Dr. Irfan, Dr. Rushikesh, and Dr. Vimal, you've really hit the nail on the head. I think it's wonderful. I shall pull the curtain down on the show today. We have crossed our timeline, but it was very educative, very informative. I hope the people out there understand that today it is very important for us to have medical consultation. The fact of the matter is that we must be healthy in our locality, in our regional area, in the city of Mumbai, state of Maharashtra, and in India, for India to move forward. So therefore, my request is to all of you, stay well, stay healthy. Whatever we have discussed, if you can try and implement that, it would be a great thing. And I wish you all the very best on this World Heart Day. And I hope every one of you are well protected and have the blessings of the Almighty. Thank you all very much for this session.
Thank you,
Thank
sir.
you all for being here.
Thank you,
And I
sir.
thank all my panelists
Thank you,
for
audience.
such a lucid
Thank you.
and a lovely session that will be so educative. Thank you all.
Thank you, sir.
Thank you, sir.
Thank you, sir.